I'm looking out this window, I forever dream I can shine a light up on everything. They say the obstacles are easy, but it never seems like. Hello, hello, hello. Dream is just a way to a beautiful light, yeah. Hello, hello, hello. I'm alive during the day, but a star by night, yeah. Hello, hello, hello. I take what I can take, and I start to fly, yeah. Hello, hello, hello.
Hey, what's up, everybody? I'm Jimmy McGill and Chris Dickey, and today we are at the Recovery Clinic. Thanks for tuning in. If you don't know, Chris and I are both people in long-term recovery from addiction, and today we spend our lives carrying a message of hope to other people in early recovery or active addiction that people can and do lose the desire to use, and that you can find a new way to live.
Tell them.
Huh?
Tell them.
Boy, it's fire. It's fire. Hey, listen, if you haven't already liked and followed our page, The Recovery Clinic, please go do so now. Share the video. We've got a wonderful guest who's overseeing a number of wonderful programs, and this is a chance for Arkansans everywhere that need this information to get plugged into
We
the
can't
right
wait
sources.
to introduce Dr. Rick Smith. And
Speaking of that, go.
right before we get into that, Dr. Smith, the Recovery Clinic was really built around the idea of continuing support and accountability for people in early recovery and long-term recovery.
Yeah.
We noticed that when the pandemic rolled through our state, and a lot of individuals that appeared to have a strong foundation in recovery just kind of drifted off. And so Jimmy and I got together and thought we need to do something to keep people engaged, and the Recovery Clinic is one of those solutions to that. So everybody, please welcome Dr. Rick Smith. He's the director for the PRI Institute at UAMS. How are you doing today?
I'm doing well, and first let me say congratulations to not only what you all are doing, but everybody that's working toward recovery, because it's a daily work toward recovery, and everybody that's either contemplating it or doing it or involved in it or sustaining it needs to be congratulated and encouraged. It's a tough road.
Thank you.
And I respect you and salute you and your viewers.
Well, I really love that you just talked about contemplating. That's one of the first steps.
Yes.
And you have an initiative that we're going to talk about here in a little bit that really allows people to take that action after the contemplation's complete, when they're ready to take action.
Right.
You know, we've got, Arkansas is a rural state, and so the program that you're working on really allows people to reach some of those resources that could save their life.
Yeah,
and so we
absolutely.
are looking forward to talking about that. But before we get into your professional career at UAMS and some of your background and what you do today, do you want to share anything about day in life of an Arkansan when you're not running these programs?
I think it's important for everybody to acknowledge that the pandemic is tough.
Yeah.
And it's just tough on everybody, and it's tough on people that have mental health conditions. It's tough on people that have substance use disorder conditions, and it's just tough on everybody. And we have to think about this pandemic, that we're in it for the long haul, and it's not going to be over next month, and it's not going to be over. I'm betting on next summer at 2021, but it may not be over then. So we got to get some breaks. And how do we sustain ourselves, and how do we sustain each other in order to be able to make that happen and to work? And I think that obviously the social support that you guys are doing and the treatment support that you're doing is vital, and we can't do it without each other. Just people trying to do this stuff by themselves, it's hard.
Absolutely, yeah. The opposite of addiction we talk about a lot is
Connection.
Staying connected. And for some, right now, the only connection they have is to the internet and to
Yes.
talk to us today.
Yes.
And so we're excited. Just almost forgot. So our viewers that are watching, please drop your comments, questions for Dr. Smith or Jimmy and I in the chat box. Please use that at your discretion.
Yeah.
It's public. It stays there.
Yeah, remember what you say in the comments is there for eternity. So
Yeah. Brett Franks, how you doing? Hello, my recovery family. Back to you too.
Why would you call Brett
He's
out?
right
Like,
here on my
oh,
little chat.
I'm like, y'all keep
He
Brett
said
in your
hi.
prayers. You know, Brett's sick and he's been battling COVID, and that's an example of why the recovery clinic is so important, right? Like just because we have to social distance doesn't mean we have to social isolation, and that was the main, reason that Chris and I began this whole endeavor in the first place, right? Like we saw the naloxone rates triple, and we saw people in our recovery community committing suicide and returning to drug use, and
Yeah.
so this is it, that once a week shot.
Self-care. So we used to do this little mental health check-in. What color are you?
Yeah,
Green's
okay,
the top.
so, yeah.
And
Green hard.
when we first hit, Jimmy and I kind of went like this. We fluctuated. Jimmy's like all green all the time. He's like, I'm wonderful. I'm reading. I'm able to prioritize and see
Yeah.
things that are important.
Yeah.
And then a couple weeks passed, and he called me up, and he's looking out the window,
Sad.
sad, like it hit him. And
Yeah.
and so when he was in green, I was not in green, and he was kind of able to elevate me up. And then when he was looking out the window, wishing he could go play, we were kind of, I was in the green
Yeah.
at that point. So you're right about that. It's like, it's the roller coaster, and we want to make sure that we're taking care of ourselves.
One of the things that's important for your audience and for all the population in Arkansas to understand is that there's a recent paper that came out by Dr. Vokow and a colleague of hers, and she's the head of the National Institute of Drug Abuse.
Yeah.
People that have substance use disorders are 50% more likely to get COVID than people who don't. And there are multiple potential reasons for that. One is people have compromised. Some people with substance use disorders have compromised lungs, and so they're not able to fight the infection. The other thing may be that they may not be using great judgment on where they're hanging out or where they're social isolating and how they're doing it and how they're masking. But it is a real public health problem it's even more of a public health problem for people who are in recovery or headed toward recovery. And they just need to know that not only is there a health problem for substance use disorder, but you're also more at risk for COVID-19.
Yeah.
And people have to really pay attention to that.
Thank
That's
you for
important
saying that, because
information.
we see
Yeah.
people like celebrating recovery birthdays, just hugging on each other.
Yeah,
And
going from community
While it's
meeting to meeting.
while it's an important milestone, we
Yeah.
got to use. You have to exercise caution. This is a real, and
Not just caution, say it like it is. Common sense. Common sense. Like Dr. Smith just said that we're in recovery from the disease of addiction, our substance use disorder, right?
Yeah.
That means we're 50% more prone to catch COVID. 50%. So don't come around me hugging me because you got a clean day.
yeah,
Yeah. It just gets me fired up.
Sharing cake.
Yeah.
Hey,
That's
here,
how
you want mine?
That's how Brett got sick.
Yeah, I mean, Brett, you can contest this if you want, but I don't think you will. I
You
think
can
you'll-
file an appeal, Brett.
So let's talk about AR Connect.
Yes.
It's
Let's get it.
it's an initiative born out of emergency COVID
Money.
19 money.
Yep.
And it's a virtual mental health and substance abuse program. So will you just kind of explain the 40,000 foot view, and then maybe we
Sure.
can get into the weeds a
Sure.
little bit?
So one of my colleagues is Kirk Lane, the drug czar,
wonderful drug
and
czar, yeah.
the drug czar, and we were in the early days of COVID at UAMS, UAMS sort of did major transformation to be able to take care of all kinds of patients, and they released the regulations on televideo, and we were able to pivot there in a hurry within about 5 days to go from seeing people 100% in person to seeing 80% of our people online. And then we thought, well, what, that's just our people. They're already connected with us. What about all these other folks? Because we also suspected, and it happened, that many recovery programs and mental health programs, they might close. I mean, they might close because they don't have providers. They might close because they don't have payers. Just a whole variety of issues. And Mr. Lane called and said, hey, we have this opportunity for this grant, but the problem is it's due in 6 days. And we said, well, that's not a problem. We'll get it done. So we got it written in 6 days. 6 days later, they gave us the feedback and said, we need a little more information. We got that back in 6 days, and then we opened. So it was a Herculean effort from a lot of people. But what the program is anybody in the state can call us either on 501-526-3563 or 800-482-9921 24/7. And for this crowd, and it may also have depression or anxiety, but for this crowd, if you need help with your recovery, call us 24/7 and we'll have people answer. We'll do emergency screening, and then the next business day we will hook them up with an appointment with a mental health professional. And from there we'll go all the way to helping people get the resources they need to pay for treatment, to getting them connected with a local provider if they need methadone or Suboxone or medication-assisted treatment, or even just to get to an AA meeting or an NA meeting or whatever it is. And some people can continue with us for as long as they need treatment, so they don't ever have to move to a local provider. But if somebody says, well, I live in a place where there is local access and I want to go there, then not only will we refer them there, but we're going to check on them to see whether they got there or not, and the referral was complete. So it's a kind of a soup to nuts program that has had lots of good uptake. We wish we had more uptake in the recovery community, and we wish we could be more helpful. And I know one of the big providers closed just as we were bringing this up. And we are trying to get the word out to your viewers and hope that the network that your viewers have will spread the word for us, because we have more capacity than we have takers right now, and it's a shame for that to go to waste.
Right. So this is live right now.
This is live right now. You can call it 24/7, 7 days a week.
Right. I love how you're immediately connected to a mental health therapist, because they can do that needs assessment and figure out what resources to connect them to. Because when addiction hits, the family, a lot of times the family will try to find help, and it's a blind side, and they don't know where to begin. So giving them a number and then kind of letting the burden off of them to try and find, because a lot of times, or the history of treatment in Arkansas has been kind of the burden has been on the family to try to find those levels of care.
As a family member, I get it.
Yeah.
I mean, one of the reasons we built PRI was not only for patients, but patients and their families, and
Yes.
the families were always in our mission statement. So I think this is an extension of what we do, but it also fits in with UAMS's new initiative to be a statewide provider through digital health, and we can't go to, we are in almost every county, but we can't physically go with every kind of program in every county. But if people can use the phone or use the internet, then they can get to many services, whether it's these services or OB services or other things. So we think that's part of our job, and we want to make these services available to them.
That's awesome. Now, let me clarify it real quick. You guys got grant money to make telehealth and video health, or is it just telehealth?
It's telephone and video.
Okay.
We think the telephone will probably drop out sooner than. Frankly, I don't think the telephone is as good as televideo.
Right.
And televideo is almost as good as in person, and it's, given the situation, we feel like it's pretty good.
And so this grant money goes to provide services to people with SUD, substance use and mental health issues.
Correct.
And it's cost-free on their end?
It's cost-free on their end. So,
And it's
So
sounds like
did
it's
you
cost-free.
guys hear that? That is important. And-
Providers offering help.
And so people are asking us to repeat the number. 501-526-3563 or 800-482-9921. That's free on your end. If you need help with your drug issues or your mental health stuff, you can call this number for free regardless of what it. We ain't worried about your insurance.
What are the hours on this?
Yeah, what's the hours on
No,
it?
you got it.
Oh, I got
It's
it?
at the very top.
Let me see.
Hey, addiction doesn't take a day off, and neither can we.
It says 25 hours a day, 8 days a week.
that's right.
That means nonstop.
You added an hour.
I will say a caution. We're required by the federal government, if there's a third-party payer available, to bill them. But we don't have to. We're not going to bill the patient. They're not responsible for the copay or any of that. And we do bill them. But we'll take care of all that. And if there's not money there, there's just not money there.
Yeah.
So nobody should say with this service, I don't have the money to
Right.
start my recovery
Yeah.
or sustain
All you
it.
got to do is one of the hardest parts.
Well, you've done,
I say
the work.
Yeah,
They made it easy.
the heavy lifting. But all you got to do, right,
Just
is
call.
ask for help. Call that number. But
That's
that
hard.
phone can weigh 1,000 pounds.
That's right.
It weighs more than a dope sack, I guarantee you that.
Yeah, it does. But you can do it.
You
if
can.
you're out here struggling, I mean, you can.
Chris
you can pick
did
that
it.
up.
If Chris
Jimmy
can
did
do it, this dude. If Chris can do it, anybody can do it.
I think that's a genius idea that you all have had about how to help people sustain recovery.
Yeah.
And I think the recovery, I mean, it's a lot of debate about whether it's all or nothing, whether you're abstinent or not abstinent, or but I think people obviously struggle. Even if they've started recovery, they may only be halfway there. They may not be where they want to be, and they need a boost.
Yeah.
And if you're isolated, or you're worried about getting your grandmother infected with COVID because you're going to a meeting, you have to. You need. This is a good resource.
Yeah.
This is a good resource. It's not for everything. I mean, we obviously can't dispense methadone or Suboxone this way, but on the other hand, we can do a lot.
Yeah, absolutely. And I like what you said about the phone dropping off because it's just difficult with this population. But then you said something that I have been, saying equally. The research supports face-to-face interaction. I mean, that's what you need to be connected.
Yeah.
Virtual telehealth is almost there, but it's not. But what you
It's
said,
close.
the caveat here is it's what we have right now in the middle of a global pandemic. We can't lose sight of that. And so if that's the only way to get help, do it. Don't wait. Call today if you're struggling, and let the river of recovery sweep you away in the current.
Right. And then, frankly, I mean, if in 3 months we get a lot of people that are needing recovery support and need to be in a group, I mean, we can Zoom groups.
Yeah.
I mean, you all may be Zooming groups already, but we can Zoom groups and set up beyond individual things.
Yeah.
So that's not beyond what we have the capacity to do, and we're doing some groups already on Zoom for both substance use disorder, but we're also doing it for depression and other things.
Yeah. And I think you touched on one of our largest providers had to close. I was talking to Director Lane about a statistic that recently came out. Within the last 5 months, we've seen treatment admissions drop. And I think some of the explanations to that is obviously some of our providers shutting down, but you also have, there are providers that I know that were partial hospitalization programs and intensive outpatient that have completely transitioned to virtual, which can affect someone if they don't have a job or the means, to,
Right.
or if they do have a job and they can't attend. But we're starting to see an uptick
Good.
in admissions,
That's
Great.
good.
which is very good.
That's great.
I think people are finally wrapping their arms around their situation and beginning to figure some things out.
We had talked about Dr. Mike Mancino earlier before we opened up on the air, and I asked Dr. Mancino the other day, why are we not seeing more takers in recovery? And he said that his opinion is that it takes a little longer to sort of decide to do something if you're using and deciding to get into treatment, and that that it's just the nature of the illness to be able to be a little less proactive and trying to stick with the old ways of doing things. And so that fits with your model that you're talking about.
Yeah. We, at Natural State Recovery Centers, we've just blended. We're pretty strict when it comes to screening, and some of those other programs you can't get admitted without a negative COVID test, which I think is important. But like you said, meeting people where they're at, a person-centered approach to finding resources. We've, for the people in outpatient, if they need to do virtual telehealth, we're able to provide that. And so I just love the recovery community and the treatment industry and what initiatives like you're doing, because we've instead of staying in these little silos, we've reached out during this and we've bridged the gaps on a lot of things, because we're realizing like this is obviously the pandemic has elevated the need to work together.
Yeah.
And I think we through the creativity of great minds and wonderful programs we've been able to develop. I mean, the AR Connect wasn't here 5 months ago, right?
Yep.
But out of necessity, here we are offering a 24-hour-a-day, 7-day-a-week service.
Free.
That's amazing.
Right.
I'm very impressed, because Arkansas is traditionally, it's a rural state.
Yeah.
And so, Jimmy, what do you say about the recovery videos that we do and the importance of recovering out loud so people don't have to die quietly?
Yeah.
Dr. Rick Smith might like how you say that about how you are able to go where.
Yeah, so the whole reason that we use social media to promote, right? Like, we're taught to keep our recovery first. That means I can't go anywhere that's unhealthy for me, anywhere that's toxic, anywhere that puts me or Chris at risk. We're not going into the dope house to pull you out. You know what I mean?
Right.
But what we can do, and the reason that we make videos, is because handheld mobile devices are everywhere. Internet is everywhere, right? We can't go in the dope house and tell you anybody can lose the desire to use. You don't have to get high again, but the video can. See, we can reach you through televideo safely and
That
keep
too.
my recovery first.
Well, you have two reasons to stay out of the dope house.
Yeah.
One is your recovery, and two is there's probably COVID in there.
Yeah, I guarantee you.
Yeah.
I mean, that's not
But,
to try to scare people. It's just closed spaces and.
Yeah, Jimmy's had messages saying that there's some really unsafe, dangerous environments that people are living in outside of the substance use disorder.
Yeah.
And so he's had people reach out to him and say that they were in a closet watching his videos because there's just a lot of terror out there. And so they're in here just trying to find some hope. So we really like that.
Can I say things about briefly about two related conditions that I think people ought to pay attention to? One is alcohol sales are through the roof.
Absolutely.
And their lines at the liquor store unbelievably. And with the bars closed, and besides, bars are dangerous from a COVID perspective, besides just threatening somebody's recovery. So I really think that, and people go to alcohol a lot when they're anxious, and one of the hallmarks of COVID is it makes people anxious whether you got it or not. You know, you don't have to have the disease to be scared of it, or to be scared of what's going on. So that's one thing. The other thing I want to caution people about is if you have a medical marijuana, which I object to the term, but if you have a medical marijuana dispensary in your community, I can guarantee you the parking lot is full, and I can guarantee that everybody's buying their full allocation as often as they can buy it.
Yeah.
And that is not healthy for recovery. It's probably not healthy for much of anything.
Yeah.
And I know that's a controversial statement, but I just think I think it's just very important.
No, I mean, you have people that have never experienced depression or those symptoms or anxiety, and so they're trying to change the way they feel through whatever coping mechanism. And if they've got that, it's just really it's playing on a bridge without guardrails right now. I mean, you may cross that line,
Right.
and
So
not be able
I
to.
want to dig into something you said, like about the medical marijuana. You object to the name, that term, right? Like, so my personal perception on it is, I don't know about anybody else in recovery, but I ain't smoking anything. I'm not. Like, I can never do it, no matter what it is. But it cannot be prescribed, right?
No, it's not prescribed. You have to have a condition that qualifies under state law, and then let's say I give somebody a diagnosis that in their medical treatment, somebody can, even though I won't sign anybody's certificate,
Right.
they can take their medical records that I made the diagnosis and go to a clinic and pay $30 and get somebody to write them out the qualifying card to take to the health department to get their card.
So what that sounds like to me is more of a registration fee and a license
To buy, yes,
to buy.
legally.
So there you have it.
Well,
There's
you
no
have-
such thing as medical marijuana.
You know, there's a big billboard that says AR Cannabis.
Yeah.
You've seen it?
Clinic,
Yeah.
yes.
Jimmy and I are on some billboards now. We're combating that.
Yeah. The
That's good.
recovery
We're trying.
clinic billboards.
Good,
Yeah.
We're coming after them.
good.
Back in the day when I wasn't so spiritually fit, I'd have climbed up on that billboard with some spray paint, but I'm not going to do that. That's good.
Well, is there anything, thank you, first of all,
Yeah,
for
thank
what
you
you do
very
with
much.
AR Connect. There's a lot of other things we can talk about, but I think this was the really important thing that we wanted to get across to the viewers. Is there anything else you'd like to cover and share before you have to leave?
I think many of the people in recovery are also going to have other mental health conditions beyond their recovery. And it's going to be anxiety, it's going to be some depression. Sometimes that's appropriate to treat with safe medications, and sometimes it's not. Sometimes people just need some psychotherapy in addition to that, and our therapists are there and can help. And I think, especially if you're isolated, I mean, this whole thing is really tough for isolation and loneliness.
It absolutely is. I mean, I went through a little bit of depression myself.
Yep.
I mean, I mean, I can't stress the importance of staying connected and continuing to get what's in here out.
No.
Because
That's a
I
terrible.
don't know about you, but up here, me being alone up there is like being lost in a bad neighborhood.
Yeah.
Well, yeah. Well, you know,
Looking for trouble, or trouble will find you.
Oh yeah, definitely.
we talk about changing people, places, and things, but the truth is, the last person I manipulated, lied to, and used with was me.
Yeah.
Right.
Yeah.
So, thus the old cliche: a person alone in recovery is in bad company.
Yep.
You know. It's words of wisdom. We
They're
call
words
that
of wisdom.
We call that Jimmyism.
Jimmyism.
Nuggets.
Yeah.
Probably hard-earned wisdom.
Yeah, it was hard.
Well, Dr. Smith, thank you so much, and maybe at a
Thank you
later
all.
date, there's a lot of other things the PR Institute and under your direction is doing. Maybe at a
We're
later
happy.
date we can
We're
have you back on.
happy to visit, and happy to have folks call us if they think we can be of help.
Absolutely.
Awesome.
Thank you so much.
Okay,
We'll,
you bet. We'll social distance there.
Hey, oh, Doc gave me an elbow.
There you
bump.
go.
All right. So, Chris, where we at, man?
Well, we're in. I'm walking through it.
You walking through it?
I am.
Okay.
You know what's going on.
Yeah.
I mean, we were on the plane coming back from Virginia,
Yeah.
and I got last week I shared that my father's really sick.
Yeah.
He's battling lung cancer, and we're trying to make him as comfortable as possible. And while we know that he's sick, it's we're sitting on the plane getting ready to come back from Virginia, and my sister reached out to me and said that he'd passed away, or in the night. And
Yeah.
I'm still processing and trying to articulate some of these things that are going on in me. But
Yeah.
guess who I was with? A person in recovery.
Yeah.
When I got that news. Why is it so important that I continue to stay connected? It's that.
Yeah.
If let's say I was drifting away, let's say I hadn't been maintaining my recovery in the way I was taught,
Yeah.
right? Let's say I get that news somewhere else. I don't know what would have happened.
Yeah.
I mean, it's a natural part of life, loss, right?
Yeah.
Tragedy, and trying to find a way to process that healthy. It's natural.
Yeah. Thank God you got a recovery program.
It's
you know
just
what I mean?
difficult.
You guys weren't there, so you don't know this, but even Chris's family is thankful for his recovery community, right? Like his wife met us at the airport Sunday evening when we landed.
What's the first thing she said to you?
She said, "Jimmy, I'm so glad he was with you." Like,
Sorry, guys.
That's crazy, man. You okay?
Yeah, no, I'm in a good place. So one thing I really want to share with everybody is the one of the biggest blessings that I've gotten so far out of this experience of saying goodbye to my dad is, I got to lay on the bed next to him
Yeah.
and hold his hand and rub his hand. And I could feel him kind of relax a little bit. And he got to be there with his son. And we weren't saying anything. We were just, being with each other.
Yeah.
And there's absolutely no way I would have been able to do that
Yeah.
without the recovery community wrapping their arms around me when I was early in recovery and showing me a new way to live under a new set of principles.
Yeah. Yeah. Well,
I wouldn't have been able, because my dad and I had struggled with our relationship.
Yeah. It's a tornado.
So it is. And so, without the support and accountability that I had and strong mentorship, there's no way I could have been there for him.
Yeah.
And I am so grateful that I got to be there for him.
I'm glad
he's
you got to be there too, Chris.
He was trying to stand up. This is Thursday, right before we went on the plane. This is last Thursday. And he was trying to stand up, get situated. He was falling off the bed a little bit. And so he stood up and then sat back down and did a little dance.
Yeah.
But that was him
Did
trying
a
to
little
play it
dance.
off.
Yeah.
But I got that.
That's cool,
I got
man.
that. And I will say, my sister
Yeah.
got to be there when he took his last breath. And that's how it was always supposed to be.
Yeah.
They had a special bond, and I'm really grateful that she got to be there for that.
Yeah.
But I appreciate everybody's support and reaching out. I'll be in a puddle of tears if I share how grateful I am for the support you have given me and our family.
Yeah.
By lifting us up in prayer.
Yeah. For sure.
It's very special.
Yeah.
And
Well, you're a very special person to not just me, but everybody. Most people watching know you or have met you. Like, you're literally in the middle of planning funeral services, and you're in the news station talking recovery to keep somebody else from getting high, Chris. Like, that's
It's important to me.
that's
You're
special.
important to me. Someone, and you can appreciate this when a lot of times someone will say thank you for when you show up for someone, and my response is always, you're worth it.
Yeah, you're right.
And you are worth it. So
So
let's pivot a little bit.
Let's pivot. I got to tell you guys something. Chris and I got to hang out with Miss America 2020, Camille, and she was awesome. We also met Dan the pharmacist. If you haven't watched his Netflix series,
Please
The
do.
Pharmacist,
Dan Schneider,
powerful.
The Pharmacist.
Yeah.
It's an incredible story.
Yeah.
First of all, of heartbreak and tragedy, of course,
Yeah.
but what he did with that.
Yeah.
We're not going to give anything away.
And he'll
Just
be on
please
the
watch
show
it.
in
4-part
the near
series.
future.
Many of you can binge that in
Hour.
Yeah. Watch all 4 of them.
At the same time.
Yeah.
Ooh.
Yeah. But it's very powerful, and Dan is a great guy.
Yeah,
he's
awesome.
from Louisiana, and we got to spend the weekend with him learning about
Yeah. We
what
had
he's
dinner
planning.
with him.
We're going to have him on the show. He's going to call in. We just got to schedule that out and
Yeah.
see how that plans. But
We're also going to have, Camille, Miss America on here. And I got to tell him, Chris, I got to tell you guys, I heard her speak something that was so powerful. Like, let me ask you guys something. If you're watching right now and you know someone who actually died from COVID-19, type the word "me" in the chat box. Okay, I'm not saying if you know someone who caught COVID, but if you know someone who's died from COVID, type the word "me" in. And so that's what she did. She asked us. And so a few hands out of 400 people went up, right?
Mm-hmm.
But then she asked, now how many of you know someone who has died from an overdose, who's died from addiction? Every hand in the parking lot went up, Chris. And she said, so we carry these masks. And we carry these masks to save each other's lives, right?
Mm-hmm.
From COVID. But with all the hands that just went up, why is it not mandatory that we carry Narcan to save someone's life? Because everybody knows someone who's died from the disease of addiction.
this is Miss America.
Miss America.
Which, one of the things I appreciated her saying is, everybody views her like she's a princess out of a Disney movie.
Princess. Because
And-
she's got a crown.
But here she is dropping truth bombs,
Nuggets.
causing people to think and reflect.
Reflect hard. Dude, we're national advocates, Chris.
Mm-hmm.
And that slapped me.
Yeah,
Right.
We
in the
can't wait to
face.
have her on here because she's a pharmacist student.
Yes, she's a
And,
pharmacist.
She's an incredible human, and
Yeah.
and for her to really focus on this at such a young age that she is, really speaks to me that we're moving the needle in the right direction with getting awareness out
Yeah.
to try and curb the opioid epidemic.
Yeah, man, that's just powerful.
It was a much needed trip to be around people. I was joking with Jimmy that we spend little getaways going and trying to create awareness for overdose.
Yeah.
To prevent that, and I wouldn't have it any other way. You won't find me with my feet in the sand at the beach.
Yeah.
Not disparaging that. I probably would.
I would
probably
love
would
to
need
have
to
my.
do that.
I'd love to have my feet.
Probably need to do that, but
in
I'm
the
not. I
sand.
just want to keep going. I get energy. I get fired up doing
Yeah.
what we do.
Yeah.
The state of Virginia loses 3,500 people a year to accidental overdose.
3,500 people.
Jimmy and I are going to get together and do something really special. We're not going to say it today. We've got to do some more planning on it, but we have a big announcement coming for
do.
our state,
We do.
for the state of Arkansas. We're going to practice R&D, rip off and duplicate
Oh,
of something.
yeah.
He's connecting it right now
Can't tell
of what
you.
we're going to do.
Can't tell you. It just.
But it's going to be
Seed
very
been planted.
It's going to be very important and powerful for people
Yeah.
on the fight against
That's good.
addiction.
That's good. With the overdose numbers on the rise the way they are, it's not okay to not share recovery.
We're behind.
Yeah.
We're behind right now.
Yeah. Yeah.
We say this a lot, you probably get tired of it, but the pandemic has wreaked havoc on the recovery community.
It has.
And it's starting to get to a place where,
Well, it's starting to make me mad.
I know.
I don't know about Chris. and
You
I
know
don't
why though?
I
It's
don't-
because it's getting out of control.
No, it's not that.
We were making a difference, and then it hit, and
Yeah.
now it's starting to get out of control.
Well,
the last 6 months, I think overdoses are up 40%.
Right.
From where they were.
Here's
And so-
here's what I'm saying, Chris. I'm not talking about that part. I'm talking about the part where everybody in the world is screaming, wear a mask. The pandemic is contagious. Way before coronavirus hit, addiction was kicking us in the butt. We've got...
It's funny that just
Yeah, vibrated right then. So that's what Chris associated with the word butt was
I'm sorry.
So anyway,
It absolutely was.
the truth of it is people are dying every day. The coronavirus has less than 1% death rate in Arkansas for sure. I mean, almost. The recovery rate is astronomical compared to the fatality rate. Now, I'm not downplaying that at all, but I'm not going to sit by and continue downplaying those who have died from addiction either, Chris, because the numbers, you look at what coronavirus has done and it's right here. You look at what addiction's done and it's up here.
We can multitask.
It doesn't make any sense. Why don't you, where's the outrage? Why is everybody not pulling together and fighting for recovery the same way you're fighting for a mask? Where's it at?
We're here.
No,
We're listening
we're
right now.
here, but where's it at?
Yeah.
Where's the outrage at? For real, outrage. I'm so mad now I can't even talk. Outrage.
Hey, look at this.
Jimmyism.
Hey.
Nugget. Cool me off now. I get hot. Cool me off.
Hey, one thing before I forget, and I appreciate you, first of all.
Okay.
And thank you for saying what you just said, because it is important, and we need to continue to speak up and speak out.
Speak out.
But one thing I do want to cover before we leave today, something that Dr. Rick Smith and UAMS was the first in the state as a hospital to do is
Peer recovery.
peer recovery. They hired
Kyle
peers.
Brewer.
Kyle
Yeah,
Brewer.
Kyle
Now they
Brewer.
have 3, but they're in the emergency room.
Well, one is.
One
One or
of
two is. Kyle and Sean are in the ER, and then Tawana is actually in PRI with
great,
with him.
great. What do they do in the emergency room?
So they meet people where they're at. When they come in from a drug overdose, they introduce themselves as people in recovery. They offer to get them into treatment, and so they share a little bit of their story, enough for the overdose survivor to validate that that person's authentic and it's not a game, like you're not staff or the police or.
Yeah.
And so from there, they tried to build them up and get them into treatment.
When peers were first being talked about and adding as a supplement to these professional medical services, there was a lot of fear, like peer recovery was going to take over. But what we see is peers can go places where
Other people
can.
In a nutshell.
They've got the right serum at the right time
Yeah.
to help someone
We're
make
connected.
that decision.
Yeah. And we're connected everywhere.
I'm
From
telling you, like,
parole office, law enforcement, criminal justice, treatment centers, recovery housing, like.
yeah. I had a peer this morning reach
Yeah,
out.
tell that story. That's good.
And say, just another example. There's hundreds, if not thousands, of examples of how peers make a difference.
Yes.
We have somebody right now that was really worried that he wasn't going to have a safe, sober living environment, and he was worried that his parole officer wasn't going to help
Yeah.
or sign off on it.
Yeah.
So our peer that works with Natural State asked, "Who's your officer?" And because of his lived experience, dude had it in his cell phone in his
Had the parole officer.
the parole officer's number in his phone. Called him up and said, "Hey, I'm working with this person," and he's like, "Oh, I didn't know you're working there. I'll sign off on that. We trust that."
Just like that.
Yeah,
Plug.
yeah. But here's what that does. Not only does it make the day of the person that has a sober place to live now for a while, and so they can build that recovery foundation.
Yeah.
But when this person's feelings get hurt because they get some truth they don't want to accept right away, instead of running away, the peer has already built that trust and respect with one another, and that person can go to the peer and work through whatever thing they need to work through.
That's good.
But that's a supplement to what's going on. I mean, it's just, I don't understand why we have this and that. It should be under the same umbrella.
Yeah, well, when we look at each other,
programs should be recovery oriented, not this. We just do this, or we just do this, or you can't come here because you don't fit this mold.
Right, recovery is the solution for addiction.
Meeting them, helping them.
Yeah, I get that. But there's a lot of silos, right? Like everybody's competitive, and everybody wants the credit, and the truth is, there's no limit to what we can accomplish if we don't care who gets the credit for it.
Right.
And when we look at each other as competition, we miss the chance for collaboration. And when we collaborate, stuff like the recovery clinic happens.
Yeah.
You know what I mean?
Yeah.
But everybody doesn't have that mindset. And
We just got to keep leading the way.
Yeah. Yeah.
So, I think we're going to talk to you about our next week's guest and let you guys get back to your day.
Listen, so
Jimmy's excited about that. I am too.
Well, I have not been.
But Jimmy knows this person personally. I don't. I'm looking forward to getting to know.
Well, like I follow her on social media. She made my faith gang, my T-shirt that.
You're going to be wearing it next week.
I will. It says faith gang, right?
We need to get one for me.
You know, I'm a Christian and I love God and I love recovery, and so I love my people too. So I'm part of the faith gang. You know what I mean? That's fancy, Ricky. I know you think that's fancy. But Michaela, yeah, she's overdosed 13 times. You may follow her on Facebook, Michaela Wingfield. She is next week's guest, and I have not been this excited.
What a great way to close out Recovery Month.
Oh, yeah.
September's Recovery Month, if you didn't know.
Right.
And so we're going to showcase just a very powerful story of why we do not give up.
Yeah. Dead people can't recover, and she's proof of this. Like,
some of the most hateful things I've seen is why revive them after 2 times? Well, this person is a beautiful light in the world.
Yeah. Yeah.
And has overdosed 13.
She's very magnetic.
Yeah.
You know what I mean? She's got a very magnetic personality.
Good, I can't wait. So tune in next week, 11 a.m.
Yeah, for Michaela. Yeah, absolutely. If you haven't already liked and followed our show, please do so. Let's go through the comments real quick, Chris, and let's give everybody some shout outs.
Jen Schuler.
Always. Jen's always going to support. Austin Lee.
She says, I'm going to need a copy of this episode for our grant. Hey, you take it. Copy it. I don't
Dan-
know how we would get it to you. But
Dangy, Amy Scarborough, Mache, what's up? Tammy Camp. Oh, man, the list
Teresa
goes
Elkins, thank you for joining us today.
on. Sherman
Teresa.
Cooper, yeah. Nicole Smith's in the house. Amber Owens, she said, great job. Thank you, Amber.
If you didn't get enough of us talking, now you can watch us look at our phones.
Yeah, and talk about you. Brooke Dunlap's in the house.
Thank you for everybody who has sent their love.
Crystal Holland, thank you for always supporting and being here. Patty Yeager.
Joe Ray, Ben Brown. Ben Brown can't have a show without you, bro.
Who? Chelsea McGill. Well, I know her, Ricky. I
Better
know
shout-
her. Put
better-
the camera on me.
better
I know her.
Shout out.
Hey, yeah, that's my baby there. Sherry Stevens, Noel Hunt. And so, yeah, the list goes on,
Yeah.
man.
We're just really grateful for you all. Please share and like our page, like Jimmy said, and Shed.
Jimmy
Shed. And join us next week. We've got a great way to end the Recovery Month and that celebration and honor.
Yeah, we love you guys, and we will see you next week.